Hello guys, today we will dive into caffeine addiction, which is presented by Group E. What is caffeine addiction? It is an excessive and harmful use of caffeine over a period of time. Consistent use of caffeine changes the chemical makeup of the brain, which can make quitting difficult and cause fatigue, headaches, and nausea. What is the difference between intoxication and withdrawal? Intoxication is the reaction that follows the ingestion of excessive caffeine, usually more than 250 mg. While withdrawal is side effects experienced by a person who has become physically dependent on caffeine. Person that has risk to develop intoxication are children and adolescent. This is due to their low body weight and lack of tolerance. First-time exposure to caffeine also has high risk of intoxication, and the person who used OCP can cause decreased caffeine elimination. And last but not least, genetic and physiological factor. The complication of intoxication will cause dysfunction at work or school, failure to fulfill role obligations, social indiscretions, fatal if in extremely high dose, and caffeine-induced disorder. So what are the symptoms of caffeine intoxication? Symptoms of caffeine intoxication include those listed below, and someone need to have at least 5 or more of these symptoms to be diagnosed with one. Some examples are such as inability to sleep, restlessness, constipation or diarrhea, excitement, muscle pain, fast heartbeat, and more. Here are the drugs that can be used to control the symptoms. Other management are gastrointestinal decontamination, elimination enhancement, and extracorporeal removal via hemodialysis. So here are the indications for hemodialysis. Next, let's talk about caffeine withdrawal that develops after the abrupt cessation of prolonged daily caffeine ingestion. Studies show that the prevalence of caffeine withdrawal is 13% in all caffeine users and 70% in caffeine dependence. Symptoms usually begin 12 to 24 hours after the last caffeine dose and peak after 24 to 48 hours of abstinence and can last for 2 to 9 days. So, here are the risks of developing caffeine withdrawal. Now, regarding the diagnostic criteria for caffeine withdrawal. Patient must have prolonged daily use of caffeine. Next, any abrupt cessation or reduction in caffeine use will be followed by the following symptoms of headache, drowsiness, irritability, difficulty concentrating, and flu-like symptoms within 24 hours. The signs and symptoms must also cause impairment in patient's daily life and are not better explained by other medical and mental disorder. The management of caffeine withdrawals divided into pharmacological, which aims to reduce symptoms, and non-pharmacological, which aims to reduce caffeine and as well as the symptoms. Here are the drugs that can be used to control the symptoms. These are the non-pharmacological approach that can be done. One of them is reduction of caffeine. Having food diary will help to calculate the total amount of caffeine intake a day. From there, tapering can be done. That's all from us. Thank you and see you again.